Some of the most common questions that I get are about expected recovery after a knee replacement. So I wanted to outline some of the expected stages of recovery. Two key things to keep in mind are, number one, that everybody heals differently. Some patients even heal differently between one knee replacement and the other. So everyone has a different experience as far as how slowly or how quickly they heal. So bear that in mind. None of this is on an absolute timetable. There are substantial variations. The other thing is that the patient's condition preoperatively influences how quickly they recover postoperatively. So what kind of physical shape are you in as far as body weight, as far as strength, as far as mobility? All of these things impact the postoperative recovery. Additionally, patients that have had a lot of previous surgery on the knee may have additional scar tissue or may have other considerations that may slow down this timetable. Somebody that's in really phenomenal shape with no other medical problems and good range of motion and strength, but just has an arthritic or painful joint, they can probably expect to have a quicker recovery. Typically, younger patients also recover a little bit quicker, but none of that is absolute. These are just some of the things that influence how that recovery process occurs. So we wanted to outline a couple of stages and hit some real common areas. So in the first 1 to 2 days, patients can expect to walk either the day of surgery or the following morning. The hospital stay for a lot of patients with no health problems is now overnight. There's a lot of transition around this as we speak. Still not uncommon for some patients that are a little slower to maybe stay 2 nights. We're working towards doing more of these in a true outpatient or same-day surgery scenario. Some of that varies depending on insurance considerations and some of the state or local regulations on that. But for most patients, it's anywhere from a same-day surgery to 1 or 2 nights in the hospital. During that time, they certainly should expect to initiate their physical therapy. That's usually going to be with a walker initially, and then over the next couple weeks will be that transition from a walker to a cane as they get more mobile and their walking mechanics become more normal. Bathing is something that I get asked about real commonly. We do use watertight dressings that are sealed, so the patient can take a shower basically immediately after surgery. Soaking in a tub or a pool needs to be usually about a month or so when the incision has really fully healed, and certainly you want to evaluate that with your surgeon before you return to doing something like that. By 2 weeks, this is when patients are seen commonly for a post-operative visit. We want to see the knee moving, things getting a little more normal. Certainly common that some people may still be on the walker at that point. A lot of people have transitioned to a cane, and some people will even be getting away from their cane by then. By 4 weeks, more of the same, somewhere in that 2 to 4 week range. We really want to see range of motion improving. Ideally, 90 degrees of flexion or somewhere close to it, and full extension of the knee. And we want to see progress being made with that range of motion in the physical therapy setting. Driving for a right knee for most people is at least a month or so, so somewhere in this 4 to 6 week range. For a left knee, it's really whenever they're comfortable in a vehicle and not on too much pain medicine and safe to be on the road with other drivers. And that's really an individual decision. It's not something that your surgeon necessarily clears you to do. But somewhere in that 4 week or a little more range. By 6 weeks, this is a common point of follow-up where we see people back. We really expect most people, certainly not all, to be off of a cane at that point and walking a little more normally. We still expect the knee to be sore. What most people describe Very early on after surgery is that there's no longer bone-on-bone pain in the knee like they had prior to surgery, but still will have a lot of soreness of the soft tissues, the skin, muscles, tendons, ligaments, everything else around the knee may still be sore at that point as they heal from surgery. Things are just a little bit tender, may not be as comfortable as they want to be sleeping or if they sit for a long time. And then really the 3-month mark is where most patients have really transitioned. They've really turned the corner where they're a lot more comfortable. We expect their strength and their gait to be getting more normal. Their range of motion is steadily improving, and they're really reaching a break point where they're significantly better than they were before surgery.